This presentation will review how to use the classification tool for the thyroid nodule mode of detection study as part of the American Head and Neck Society Endocrine Section Research Collaborative. The classification tool is a flow diagram containing 7 categories of trigger event scenarios that resulted in discovery of a thyroid finding and eventual surgery. To classify each patient, begin at the top of the chart and proceed through each question. Some patients may have more than one question that seems to apply to them. Stop at the first question that you can answer with a yes. Most of the cases are straightforward, but some can be difficult. We will proceed through each classification and start with more common scenarios. In a separate video, we will review more challenging cases. If the patient was referred to the surgeon for surgical management of an endocrinopathy, such as a hyperfunctioning thyroid, hyperparathyroidism, or an MEN syndrome, then endocrine is their classification. A hot thyroid nodule or multinodular goiter with suppressed TSH are other common examples. If a patient has an uptake scan performed for evaluation of a suppressed TSH and a cold thyroid nodule is identified, prompting referral, that is still classified as endocrine because the uptake scan was performed for evaluation of an endocrinopathy. The next category is requested screening and applies to a patient who has no symptoms but requests evaluation or a screening of their thyroid. A common example would be a patient with a family history of papillary thyroid cancer who requests to have their thyroid evaluated. A patient will be classified as serendipity if they had a thyroid finding that came about as a result of a radiologic test done for another reason that was unrelated to an upper aerodigestive tract complaint such as dysphagia or hoarseness. Some examples include a chest CT done for a pulmonary complaint, MRI done for neck pain, or a PET scan performed for evaluation of another cancer. Thyroid ultrasounds do not qualify. They are thyroid-directed tests. If a patient has a previously identified thyroid finding from some time in the past whose original mechanism of detection from that time may be uncertain and did not result in surgery, but is now being reevaluated in the absence of new changes or symptoms, they will be classified as surveillance. One example would be a thyroid nodule that has been known about for 15 years, with FNA performed at the time and reported as negative. A follow-up ultrasound was ordered when the patient established care with a new primary care provider, subsequently prompting referral to the surgeon. The next 2 categories refer to a patient who presents to a clinician with new symptoms requiring diagnostic workup. If the thyroid finding is plausibly related to a structural change that could result in the patient's presenting symptoms given the data available, then they are classified as symptomatic thyroid. Some examples include a patient complaining of a change in speaking, breathing, or swallowing, a tightness in their neck, or they self-discovered a lump in their neck that they brought to the attention of their primary care provider. In contrast, if the thyroid finding was not felt to be related to the patient's presenting symptoms, then the case would be classified as diagnostic cascade. For example, the patient had complaint of heat or cold intolerance, weight gain or weight loss, fatigue, or other symptom that might be due to a thyroid problem but the TSH was normal. Ultrasound was also ordered as part of the evaluation, demonstrating a thyroid nodule, which resulted in referral to the surgeon but is not plausibly the cause of the patient's symptoms. The last category refers to a patient whose thyroid finding was picked up on a clinician screening physical exam. For example, a patient establishes care with a new primary care provider and undergoes palpation of their thyroid as part of their screening physical, or a pregnant woman whose neck is palpated as part of an obstetrical visit in the absence of symptoms referable to the neck. In this slide, you can see the whole tool. When classifying cases, begin at the top and proceed through the questions as described in the video. This concludes the presentation on Introduction of how to use a classification tool. Part 2 will include case examples in more detail, as well as some difficult case examples for review.